Well, let's see how well I do at addressing the things that you wrote down in the journal exercise. Of course, everybody has mental health needs. These start with social connectedness. It's incredibly important for us to be connected to other people across a diverse range of relationships. They include things like family, friendships, being on teams with people or co-workers with people, or even being a familiar face in your community, having acquaintances, being the regular customer at the local coffee shop or on the bus every day. And the reason why we need to have that diverse range of relationships is because we need to have backups in case one of them isn't going well or one of them fails. And we get different things from each of these relationships. As we build those relationships, we get a sense of our social esteem, which means our value in society. And that's fundamental to our self-esteem, which is another critical ingredient in mental health. Self-esteem tells us our appraisal of our own value. If we appraise ourselves at a high value, we're more likely to invest in making ourselves well. For example, if a doctor gives us a procedure that we're supposed to follow, we're more likely to go out and do it because we actually care about ourselves. We also have to have, and this is closely associated with self-esteem, a belief in our self-efficacy. Now, Albert Bandura, a Canadian psychologist, did the research on this, and what he found was that more important than, for example, one's wealth or intelligence or strength or good looks was one's belief in their ability to be successful when comparing who was successful and who wasn't. In other words, the single most important thing in determining whether a person is going to actually be successful is just that they believe they're going to be successful. If we have low self-esteem, low beliefs in our self-efficacy, we're far less likely to go out and seek treatment, and we're far less likely to follow through on the treatment. Why would we? We don't believe we're going to succeed. Nutrition is incredibly important, and many of the people that you and I will encounter who are going through mental health crisis will be eating very poorly. Often they'll be eating a diet that is characterized by malnutrition, and even if they aren't being malnourished, they'll often be eating processed foods that are full of refined sugars. The problem with that is they're often going to be hyperglycemic, too much sugar in their bloodstream one moment, and a half an hour later or an hour later, hypoglycemic, too little blood in their sugar. And if you want to think about too much sugar in their blood. If you want to think about how that works, think about the idea that you might have experienced when you've had too much of a gap between meals. Chances are you felt grumpy, you didn't feel like you could really think as clearly as you wanted to, and by the time you got that food into your system, it felt almost like medicine because it is often so incredibly important, not only to our physical body, but to our brain as well. And so many of the people that we support eat poorly, they eat erratically, and they eat food of poor nutritive value. We also need to have sleep, leisure, and rest or respite. Our sleep needs to be regular sleep, not erratic, not too much, not too little. Our leisure activities need to be diverse and meaningful. We need what we call avocations, not just vocations, which are jobs, but also avocations. Many people, for example, work at jobs that don't do very much to fulfill their lives. But when they come home, they put their energy into something like scouting or photography or fishing or model making. And that's really the bigger purpose of their life. And that's something that many of the people that we'll support are lacking. Many of them spend their days involved in passive activities like watching television or sitting around drinking coffee or looking out the window. And they often don't have the opportunity really to find out kind of what they're good at, what they care about by exploring a variety of leisure activities. Separate and aside from sleep, we need to have rest or respite. We need to have an opportunity to take a break from the world's pressures. Could be a walk, could be a massage or a hot bath, any number of things, but we do need to have opportunities to take a break. And we need meaningful activity. Work could be volunteer work or paid. We need worship activities or spiritual or culturally meaningful activities. Even for people who are agnostics or atheists, they can still be connected, for example, to nature or to moral activity that is meaningful to them. We need creative and productive activities like art or craft. And we need intimacy, and not always sexual intimacy. Intimacy can come in the form of having a pet or grooming ourselves or getting groomed by somebody, for example, going and getting our hair done. It can be in the form of sitting quietly with somebody that we trust and enjoying a television program. It can be in the form of spending time with children. And again, I want to emphasize, I'm not talking about sexual intimacy. We're talking about a feeling of closeness to people, a feeling of being able to be vulnerable and still safe. And that's really important. We also need to have privacy, and we need it in two forms. We need confidentiality, which is informational privacy. In other words, a sense that our information will be shared at our volition, not by others without our permission. And we need to have privacy of our body. Bodily privacy refers to the ability to stipulate who touches you and when and how. And those touches sometimes aren't touches in the clinical sense, or classic sense, I should say. They could be things like taking medication, or getting a tattoo, or choosing what to wear, or how to get your hair cut. And I stress this because I think we often accidentally run headlong into circumstances where we are confronting people in terms of their body privacy. We think of it as though it's only a haircut when we're confronting that teenager, for example. But to the teenager, it's an invasion of their bodily privacy. And if we think about it from that context, we might understand why so often these types of invasions are met with absolute resistance. And this is why sometimes telling somebody they have to take a medication or that they should stop smoking backfires so violently. Ownership is actually a third type of privacy. It's really our privacy of possession and of personal spaces. For example, we might work with somebody who has a backpack full of their mementos or artifacts that they carried from them and their family of origins home to a care facility. And we need to be very careful that we don't let others take those possessions, or that we don't treat those possessions cavalierly, that we don't ask people to display their possessions out where others might see them against that person's permission. For example, we might have heard stories of people who refused to come into shelters because they were told they couldn't find a secure place for their shopping cart full of possessions. It might seem banal at first until you think, well, that possession, that shopping cart contains every worldly possession that individual owns. And there's never a bigger intersection of these two ideas than when a person owns is a pet, because intimacy and ownership, these two ideas here, really are connected when that happens. We need to have power in two forms. Autonomy, which is the power over ourselves, the ability to make choices and decisions. So as service providers, we need to find ways for people to have power as many different ways as possible. Give choices and meaningful choices, and abide by the choices you offer. Authority is the power over others. Look for positive ways for the individual to have influence over other people. Can they be a mentor? Can they be a person who does the greeting or the explaining of the rules in your facility to somebody who's newer? Can they get an opportunity to share in a group or in a public interaction a little bit about their experiences? Can they get to be the one who determines what the menu is going to have on it that night, for example? Can they teach something that they're good at to another group of people? Look for those opportunities, because Alfred Adler called these social interest, this idea of our value comes often, our reason for living comes often from how we can meaningfully contribute to society. In 12-step programs, the 12th step is to provide help to people who are going through the same things that you were going through once previously. And it's an incredibly powerful part of how people who have gone through addiction stay clean and sober. And all of these things need to be maintained in balance. Too much of anything is a problem. So, for example, we need to have social connection and we need to have privacy. We have to individualize to determine what one person's definition of balance might be versus another. However, we cannot let the scale go entirely from one side or the other. If we have a person who locks themselves away from everybody else saying, well, that's their choice, chances are they're decompensating or will, because they are lacking entirely in social connections. On the other hand, the person who's consistently socially connected and is never seeking moments of respite or privacy, there's a good chance that person's experiencing a mental health condition such as mania. We need to have healthy developmental influences early in our life, particularly in the form of the parenting we receive. So that may come in the form of our parents being good at giving us praise and reinforcement, or helping us to understand why the rules are the rules. But they also need to be firm parents with us as well. They need to be referees in social interactions, advocates, social preparers and teachers. They need to be social arrangers, helping us to connect up with good social influences like being on the local soccer team. And they need to be able to help mediate situations where people are not managing things well, for example, in sibling rivalries. So parenting is perhaps the most important healthy developmental influence, but so are many of the other things we talked about, such as meaningful activity and nutrition. These things take on an extremely important prevalent when we're talking about them between the ages of birth and 6, and even again 6 to 18. They're always important in our life, but particularly at those points. And if we don't get them, then we have some capacity to come back and recapture those, but it takes more work, more resources, and often our success can be somewhat limited. And we, of course, need to access professional help sometimes. So it's important that people get to the help that they need. It's not just a simple matter of finding a person a psychiatrist or a psychologist. The psychiatrist or psychologist needs to be somebody who has the particular expertise, if possible, in that individual's needs. A psychologist who specializes in schizophrenia is going to be valuable if that's what the individual has, but not if they're particularly afflicted by learning disorders, for example, that are having them cause issues or having issues for them in school. And it's important as well that we understand that handing somebody off to a professional doesn't mean that we're finished. Often we need to make sure that we understand that the professional is really a facilitator of the care. They can help with some things that are purely in the therapeutic realm, like counseling, therapy, or medication. But they also rely on us to go out and help people be supported to achieve all these other mental health assets that are listed here and to achieve balance. And often they need us to help convey information in both directions. They need us to help remind the person of the care plan, and they need us to feed back to them whether the care plan is working in many cases. We also need to understand there are a number of threats to mental health, trauma being one of them. Trauma can, as we said earlier, occur in the form of physical or social trauma. So for example, it could be child abuse, it could be something like being through a car accident. Those are examples of social and physical trauma. Trauma is something that can have a different effect on each person. And you might think that every person who's gone through, for example, child abuse will be significantly scarred for the entirety of their life. And the truth is, that's not always the case. And so we shouldn't always over-respond. We need to make sure that we assess the individual and that our response meets their need. We also need to be prepared for the idea that their needs may not be immediately evident, that people may have what we call a tardive or late onset effect, where initially the response to the particular trauma is somewhat hidden, but later on it emerges. And sometimes it emerges in some odd ways that we might not immediately assume are connected to the trauma. Isolation. We said social connection was an asset. Isolation is the opposite. It's a threat. Overwork or idleness, too much of either one of those things. Illness, especially chronic illness, pressurizes the person, and you probably have been through this. You've been sick and you've been asked to socialize, try to go to work or parent on a day when you're really sick. It's difficult to be effective. Imagine how that is if you have an ongoing chronic illness. Malnutrition or dehydration are threats. Substances are a threat, obviously. Pain. Again, chronic pain in particular can put pressure on a person's mind. A lack of resources. Even if a person simply just doesn't have any of the things on the first list, it can be very difficult for that person to maintain balance. And in some cases, they may have access to those things if they weren't poor. For example, they may have professional help in their community, but they don't have enough money to take the bus to get there. Or they have the money, but they don't have the bus pass. Or the next one, they simply don't know how to get that bus pass. They may lack knowledge that they need in order to help achieve recovery or wellness. That knowledge can also include that they simply don't understand that what they're going through constitutes a mental illness. This is extremely common with depression. People don't know what's going on with them and don't recognize it as something that you would see a doctor about. And even if they do recognize it as a mental health symptom, they may not recognize that they can get help or where they can get help. They may be met by social barriers. We've talked about poverty earlier, but they may also be met by barriers or a perception of barriers such as racism, sexism, or ageism that keep them from going in the door. They may perceive that they're too old to have anything done for them, or that people wouldn't receive them because they're not of the right race, or that they are not of the right gender. And so in some cases, people are reluctant based on other stereotypes that they might have experienced in their life. And particularly here in southwestern British Columbia of Canada, a person might experience some environmental factors. This isn't the only country where that might happen. Northern European countries often experience the same sort of effect. Weather can be a very dominant threat to a person's mental health. For example, if they do not get out to the grocery store or the doctor because it's too cold or too snowy for weeks or months at a time, that obviously would have a deleterious effect. And darkness can have an effect on a person because it can create seasonal affective disorder. The person gets less light, and as a result, they start to go into something that really basically resembles depression. If they already are depressed, or if they're experiencing other mental health symptoms, then that seasonal affective disorder, or SAD, can actually aggravate those symptoms. And by the way, one of the simple solutions to that is for a person to get exposed to what we call full spectrum light. So even if it's dark outside, a person can access a light called a full spectrum light. You can find out about them by talking to a doctor or by talking to a pharmacist, and sitting by that light for sometimes as little as a half an hour to an hour a day while they do something like read a book or knit. And you can see that there's a way to combine all of these things together. A person can go someplace, sit, knit, socialize, get exercise, and be exposed to that full spectrum light. And what we really want to do as we think about these two lists is be as comprehensive as we can in providing sometimes synchronized, synthesized ways for people to meet their need, just as in the example I just gave. Before we wrap up on this video, we want to talk very briefly about Abraham Maslow. If you've taken Psych 101, it's a guarantee that you've seen this pyramid or something similar. And it's a somewhat unfortunate thing that many people will never learn more about Maslow than about his hierarchy of needs. But it is a very valid model still today, and it's deserving of our attention here because I think it helps shed some insight on how we can look at people's mental health needs. If you look at what Maslow said, what he basically was saying is that before we can move on to a need that's more high on the pyramid, we need to first address the underlying need. And this is particularly focused on the Western society, but it is in some ways going to apply in almost every culture with the possible exception of the Eastern cultures. And there's a little bit of difference there that I'll refer to later. Physiological needs are our most basic. And if you think about it, if you were left to starve, chances are you would stop concerning yourself as much with your safety or with social conventions. You might steal a pie from a shelf. You might shoplift or lie to get something to eat. And you might even steal something from somebody who potentially could harm you. Once you had your hunger needs met, if you were given the choice of a safe way to get your needs met versus an unsafe way, chances are you'd choose the safe way. You'd look for safety and shelter and security. You'd look for a way to have some idea of predictability in terms of what you're going to do to meet your needs. And then after you did that, you'd start looking for a way to belong, to fit in socially. And it's really important for us to understand what I spoke of a little bit earlier, that our self-esteem is secondary to our belongingness and love being present. We need to be accepted into a group, warts and all, and made to feel like we have something to contribute and that we're loved and accepted and valued before we gain self-esteem. And only after we've gained self-esteem are we able to go on to the last of what we call the deficiency needs. In this case, Maslow refers to this one as the cognitive needs, which in a nutshell is our willingness to learn and to explore. And think about it. If you're going to go through psychotherapy, or if you're going to improve your life skills, or if you're going to learn the rules and social habits of a therapeutic facility, you need to be able to be in this red zone. Be able to learn, be willing and open to learn. And in order for that to happen, these underlying needs need to be met. And after we meet those needs, that's when we start to get into this sweet spot near the top of the pyramid that Maslow referred to as the meta needs. And the meta needs are high order thinking. They are the things that really add enjoyment and value in our lives and a feeling of purpose. Many of the people we support are going to be below this red line. And many of us get to live up in this area much of the time. In order to help people get higher up the ladder, we need to think about the order of meeting these needs. And we have to have realistic expectations of people whose needs are not being met. Without that, we're doomed to fail a good percentage of the time in our therapeutic approaches.